So here we go, guys. Are you ready? Goji, you go first. All right.
All right.
So, creating that business case for return on investment that also supports the organization of your mission. Talk about that a little bit. You're the most recent one to have to do it. So you get to go.
Okay, well, I think we all know that the risk of the patient experience not being what our patients expect is very, very high. It can really affect our financials, and we all know that. So how do we go about presenting that fact to the senior leadership so that we do need to spend this money in order to move ourselves forward and to propel our organization? And I think one thing that we are truly learning here at Wickenburg Community Hospital is asking questions and not always just thinking. So many times I think there's knee-jerk reactions, but think about if we really start asking our patients, what do they expect? How do we know how to meet their expectations if we don't even know what they are? And I found this great thing that really struck me the other day. It says if the experience is less than the expectations, then you have a satisfaction deficit, which leads to frustration and anger. So really that's so true. But if the experience is greater than the expectations, then you have a satisfaction profit, which leads to delight and excitement. And we all know delight and excitement sounds way, way better, doesn't it? So how do we get there? And I think first of all, understanding what the patient is expecting from us, we have to have a true understanding from that. And in able to get that, we have to be asking them. You have to be rounding. You have to be visiting with your patients to find out, what did you expect? Did we meet it? What could we do better? But more important than that, I think, is addressing when their expectations are too high. And how would it be able to address their expectations without making excuses, which we've always heard? That's a real skill. And I think that really develops the patient experience, because when we can explain to them, this is what to expect from us, and we're setting our own expectations, we know what we can do, then they know what to expect. So I think that truly it just comes back to Capstone's communication, just knowing how to communicate with each other and communicate with our patients, and the listening and all the great tools that we've learned. And actually we are still new. And I just remembered, I forgot to say something to brag a little bit when I was introducing myself. And just this morning when I was speaking to a patient who had some questions, and he said to me, I want to mention something to you. When I was waiting for you to help me the other day, everybody that walked by said hi to me, and they all greeted me, but they were looking at each other too. He said it was like we were part of a family. And it would mean that's communication. And that's really meeting expectations.
I loved when you and I met to prepare the other day, Goji, you made this great comment that I think the audience needs to hear, in that you said, what if our patient satisfaction survey isn't asking the right question for that patient?
Right.
And, for someone who works in a really giant organization where their average daily census in their single department is 75 or something, it's like, how am I supposed to know that? Well, any patient rounding that you do today is maybe more than you did yesterday, and to ask, right? To ask. So,
and that's really important, I think, because we don't always have a huge number of surveys returned. So if we're not asking the right questions, we're shooting ourselves. So talk about return on investment and not being able to get that most likely to recommend score where we need it to be. And you have to be sure that you're on target all the way around. And the only way to do that is by asking them.
That's right. Because patients vote with their feet. And, that's a big return on investment issue as well, is that they could go elsewhere. So, all right. Thank you very much.
Yeah.
As far as the patient experience goes, I want to say, and Sue and I have had this conversation a lot this week with others that we've been working with, that what we hear from patient experience leaders and from frontline leaders and executives trying to elevate their patient experience is there's so much data to sift through. There's so much that goes into the patient experience, there's quality data, there's service scores from your vendor, there's what the leaders are getting when they're doing frontline rounding, there's service recovery, like there's all of this. How do you put it all together to create this picture of what should I just start? How do I interpret my data so I know what to begin working on? And then how do I do that work? What exactly am I going to do in order to make this happen? So it just so happens that, she and I recently got a giant compliment from an organization that we deeply, deeply admire, the Rural Wisconsin Health Cooperative, located in Sauk City, Wisconsin, PS, the home of Culver's. But anyway, and what those ladies said to us is, you guys are the secret sauce at this. Like, this is the real deal, how you can look at someone's data and say, if you do this, this will happen. Do this, 1, 2, 3 things, and your results go like this. And you're always right. Weird, right? We don't have a crystal ball. We just did it for a long, long time. And we know how to get her done. And we have people in 30 organizations that have also done it and know how to get her done. So our gift to you today in follow-up, we want to invite you to just email us. We have a standard in our company that we respond to leaders who need us within 24 hours. And go ahead, shoot us an email. And we're going to send you a calendar link so you can set up a call. You bring us your data, we interpret it, we give you the solutions to say, do these things, and you're going to rock it. So that's our gift to you. Reach out to us, contact us. We would love to hear from you.